Thank you for joining us. I'm so excited to introduce Leigh again. Leigh was with us really about your recent journey with cancer, Leigh. So do look at the playlist to find Leigh's story there. And also to introduce you to another of my lovely friends, Clare Cavalli. It's a really exciting journey when you are a therapist and you mix with other therapists. And these two amazing ladies have taught me so much about the menopause. Now, yes, you could probably tell that I'm probably past the menopause, but in truth, I've had it 3 times. I had it when I had my hysterectomy in my early 40s, and that lasted for 9 years. Then I had it again when I had surgery. When I had again had everything in that area taken out, the ovaries, etc. And then I had it when I had my hip replacement. So that sort of left me with loads and loads and loads of questions about the menopause. So I thought, like you, the listener, you might be really interested as well. And even if you're a bloke, you need to know this stuff, okay? Because we're not crazy at all. Well, maybe we were already, but it's not being crazy, even though when I had it, I was in the middle of a board meeting having a presentation and then completely forgot my name in the middle of these amazing meetings. So, this is the sort of crazy things that happen. And my biggest issue, and I don't know what you can say about this, Claire and Leigh, was I never went red. And when you see women with menopause who go red or flushing or flashing or whatever you can't call it, people at least know. I never did. So people just thought I was crackers. Anyway, enough about Susi. Leigh, welcome back. Just
Hi.
tell everybody a little bit about why you chose this specialism.
I chose this because of my own terrible experience of an early menopause, basically early perimenopause. I was 41, and I was literally hemorrhaging all the time. I was in A&E, I was passing out in airports bleeding. I was really struggling with 8 weeks of not leaving my house. That's basically what happened in the end.
Yeah.
I'm being told it's my age, but I'm too young. So I was caught in this, like, I was like, okay, I'm 41 and my hormones are changing, but nobody can help me because I'm too young, which didn't make sense to me at all. Because I'm like, surely you should treat what's in front of you like we do.
Yes, absolutely.
Um, and I just was, and it was way before it was all in the news at the time, and it was hard to find the right information. And I was fed up just struggling, and I would be waking up in the middle of the night, like 3 o'clock in the morning, thinking everyone was dying around me. That's not me. As a trauma psychotherapist and someone who works on herself a lot, definitely not me. I'm human, but I'm not used to waking up in the middle of the night with that intense dread. So I knew I wasn't depressed, I wasn't sick, but I wasn't feeling me.
Yeah.
Um, so that's why it was my sort of journey to find out the impact on the brain, all of that sort of stuff. Um, and then I just thought, women are being, they're not being treated correctly. We're not being respected. We're being gaslit into thinking we have mental health disorder when we don't. The information wasn't correct. The media headlines are very fear based rather than information based. So that's why I do what I do, because I don't want women to go through what I went through and an earlier. And there's women, I have clients who are 29 and 17 who are postmenopausal, who haven't been listened to for years and are suffering with bone issues and all sorts of things that they should never have been put through. And that's why I do it.
Thank you. And the very wonderful Claire. Tell us a little about yourself and then why this is your passion.
Okay, so thank you for inviting us on today's chat. When I was actually studying to become a clinical hypnotherapist, menopause was something that was sort of like in my eyesight, I guess you might say, because I kept seeing it come up and seeing these coaches and stuff. And they would take you through, the advice of maybe what HRTs take, whether you should take it, all these different approaches of how to manage your menopause. But I didn't see many people talking about it from a subconscious level, because my own history is that of depression. I had really bad postnatal depression the first time round I had a child, then I had twins, and I've got what we call the father wound, so I don't have a relationship. Now, bearing in mind these are different types of trauma, and I also endured emotional trauma as a child, when I started researching more things about menopause, it highlighted to me that these different effects we have as children, or as we have in terms of having childbirth through labour, these can all have a massive impact on our dysregulation. So our hormones and our brains, and the estrogen is almost suppressed, which can then have a knock-on impact later in life when you have trauma, your menopause. So when you have the menopause and your estrogen levels are fluctuating, if they're already suppressed anyway because you've had some form of trauma, that's going to possibly cause even more severe symptoms. So if we go to the subconscious level in terms of the hypnotherapy and help to release and unblock those suppressed emotions that might have come up that have caused maybe dysregulation with your nervous system, and has exacerbated someone who's already feeling anxious to feel even more anxious, and even have more hot flashes and night sweats, which can also be linked to suppressed trauma. That was actually a study from a Mayo clinic. Researchers did it. So there are some studies about this. This isn't just me saying, oh, this happened to me and this is what happened. That's a kind of angle that I wanted to come from, because women need to know that they can take back control. A lot of women feel so out of control in the menopause. They feel like their body's being possessed. But actually, all this time in our menstrual cycle, because the progesterone and the estrogen is obviously on like a bit of a roller coaster ride, it's also understanding your cycle before you then come up to the menopause. So you understand how that correlates with your moods, but also if you've had past trauma, that's why sometimes your moods might even be worse. Because you can have PMDD, I always get it mixed up. And I think a lot of people think premenstrual stress and stuff like that is something that's like when you get all ragey, but actually it's not. And I think there's a lot of misunderstandings out there about what is PMS, what is PMDD, and what is normal menopausal symptoms and what is severe. So I think there's still a lot for us to learn. And I think, you know, like what Dr. Louise Newson says, who I did the 14 Fish training with, you know, she treats women individually. I never have a woman sit in front of me and do like a tick box exercise. It's, you are your own person. You've got a history there. What is it you're presenting to me with? And then we just have this conversation, and whatever naturally comes up, because a lot of it is stored in the body keeps the score, and sometimes they might have a lot of anger start coming up that is affecting their sleep, which was suppressed by their trauma. So all these different things are very much linked. So that's the angle I come from, and why I went into menopause from that angle.
This is really fascinating, because you're a trauma therapist, Claire, you're both into menopause, so there must be a link. So a question. I had a friend a long time ago who had a terrible, I thought she was a bit crazy, which probably was, of course, but every period that she had, a menstrual cycle, she was really chronic for 2 weeks. She was horrible. It was like a personality change. Then she would bleed for a week, and then she'd be reasonable for a week. So like out of a whole 4-week cycle, she had 1 week where she was worth speaking to, and the rest she was best avoided. So tell me what, I mean, I presume now she's slightly older than me, so she will have gone through the menopause, but would that be something to do with what you're talking about in terms of premenopause stuff?
Yeah, I mean, your hormones start fluctuating a lot. So you can be quite high, what they call high in estrogen, although you still might be dropping, but you're higher than your progesterone. So instead of being balanced, you're unopposed. So when you have your period and that week after, that's a good time for most women. You know, their hormones, the estrogen comes back and everything else. It's when the progesterone beforehand, and the estrogen is dropping before your period, and progesterone's usually going a bit higher. And progesterone, I know from working with women, can be the tricky one to get right, because it's the one where women do say they get depressed, they get down, they get quite angry when they're on that part of the progesterone. That can be the tricky one. So yeah, I mean, if your hormones aren't where they should be for you, which can be totally different for somebody else.
Right.
And yes, that can, you know, impact mood, particularly beforehand. And certainly when you're perimenopausal, I was unopposed, so my estrogen was falling, but my progesterone was there was none.
Yeah.
So I was just constantly bleeding and constantly, you know, angry as well. So yeah, definitely if you're slightly out of whack and it's not quite, and also testosterone plays a part, because if you don't have enough estrogen, testosterone converts to estrogen, but it's a form of estrogen you don't really want.
So how do we manage our hormones? Is that hormone replacement, or is there a way that isn't chemical, if you like, to alter that?
I'm on HRT, and I'm a big advocate of it. For me, it may not suit everybody. As we know, it's not a one size fits all, but within a month I was me again. I wasn't bleeding. I haven't bled since. And obviously now I'm postmenopausal after chemo, completely postmenopausal, and I haven't had hot flushes. I haven't had mood changes. It's kept me very strong throughout the whole process. But I take a Body Identical, which is the new kind of safer, they call it, HRT. It's totally identical to the hormones you have in your body, and it's derived from yams as well. So you put it on your skin, it's not going through your liver, so it's more controllable. You can adjust it as well. So if you feel that it's too much, you can reduce it. Whereas the tablets are synthetic hormone, as is the pill. So I find that women who've been on the pill for a long time have a tougher time in the menopause because they've been on synthetic hormones, and Clare will follow up on that one, I think. And she's nodding away there.
Yeah, because it's the synthetic, isn't it? And it does actually, it's almost like masking some underlying issues you might actually have with your hormones that you're not going to know about, because you're synthesizing those release of the progesterone, estrogen through your cycle. I know for a fact, because I was on the pill since 15. I went to the doctors and I said that I'm having real problems, like with heavy bleeds. So rather than it being investigated or saying, you know, wait for your cycle to start regulating after so many years and being patient with it because it's natural, you know, he put me straight on the pill. And then when I did come off it, I was like a raging mess, which is where I think, you know, the trauma that I endured had an impact. It was suppressed alongside with the pill, and therefore when I then came off it, I had all this anger that was coming out that I didn't, and I actually felt quite scared about it. And I used to, what I thought was bad PMT, and it wasn't that at all. It's because I had all of this trauma that I just didn't sort of release, because my estrogen would have been affected and whatever else. And then because they do say, if you have bad experience, and like if you've had depression, if you've had PMT and stuff like PMS, then it could also increase your chances of having a worse menopausal experience. And I know Leigh won't mind me saying this, because I'm also on bioidentical. I'm on estrogen, progesterone, eutrogestin. And I was in touch with Leigh, she's also my mentor, and I was a raging mess, and I had to try and balance out what was going on with the progesterone and estrogen, because as much as I went to my doctor, who is a menopause specialist, she still didn't give me the answers to what I was looking for to be able to control and know that I could actually dispense more estrogen to level out the balance that was right for me. Like Leigh said, you know, I've chosen to go on HRT for personal reasons and doing my own research and how it affects many long-term implications of possible Alzheimer's, all these different things. And I'm not saying every woman's going to get that, but I want to have preventative action. And I know for me, with my past, that HRT was the right choice for me. And I therefore had to dispense more estrogen at the time that I was then taking the progesterone, because it fell so rapidly. Because the estrogen is, oh, hey man, I'm like a social butterfly, I'm a nomad, I'm going to come out and I'm going to have a party. And the progesterone is like, hey, chill man, I'm going to sleep really well.
Yes, that's your chill pill.
Yeah. So, and the balance of that was just not there. I was obviously a bit too high with the progesterone. I was on the 200 milligram, and it was just like, I just want to kill everybody, and I want to cry, and I just hate life. And that's not me. I love life, and I just felt rubbish.
I think that's what they're talking about. The pill completely suppresses our own hormones, right? And replaces it with the synthetic stuff, where the Body Identical gel or spray doesn't do that. It's adding to what you naturally have. So it's not suppressing anything. It's allowing your body to have what it has. But if you need an extra bit or whatever, you can do that. And obviously there's a lot of lifestyle issues and things. You can do a lot. You know, hypnosis is wonderful for hot flushes and confidence and anxiety and all of those things, which can really, if you feel more confident and empowered in yourself as a woman to go to your doctors or to go to find what will help you, then you're making better choices for yourself. Even if the hormones are, you know, fluctuating and going mad, you'll find yourself with a hypnotherapy or dealing with that waking up at 2 a.m. And hot flushes and things. Once you deal with that a little bit better, you can feel stronger, you can feel more confident to just walk in the door. You know, I've had women call me outside their GP surgery in floods of tears with their GP making decisions without them, and that's not right either. That you have to say it has to be legally a joint decision, and a lot of doctors don't quite know that yet, without being controversial and being polite here. You know, it has to be a joint decision between you and your doctor. And if it doesn't feel right and they're not doing the right thing for you, it's one thing I found, and I advise every client of mine to take in the information, that they write it down. Write down every little question, every little bit of information that they've learned, to say, well, actually, that's not in the NICE guidelines, or that is in the guidelines. So you should do that for me. And because a lot of doctors don't even know about balancing hormones. They're not trained in this. No GP has menopause training, not one, unless they specifically choose it. And then that's like 20-minute lecture or something like that. Now it is getting better. And Dr. Newson, I did her training as well. And I've trained with other doctors. They are becoming more aware of it, but still, you know, my GP still was saying, like, why were you on the mini pill when you were on HRT? And I'm like, well, I don't really want a menopause baby, thanks. You know, my granny had a baby at 51, you know, so, and I'm not saying that would happen to me because I've had gynae issues in the past, but I just didn't want to take that risk either. And so I did the whole balancing act for a while, but I had to go private for that because the doctors didn't know. You know, you're 42 years of age and you're being told, why are you taking this and that? And I'm like, well, I'm perimenopausal, I'm not postmenopausal. So the doctor didn't even sort of distinguish that, you know. And there's this magic 45-year-old age thing, that 45 and over, we don't need to do blood tests to find out where you are, just have some HRT. If you're under 45, it's like trying to get class A drugs. You know, you can't, where men can go into Boots and buy Viagra and whatever they want, you know, it's, we're struggling even to get, you know, gentle pessaries that would help you have atrophy, you know. So it's very much, I think women's sexual health is not prioritized either. So
this is really interesting. I think we could go down a million avenues.
Oh,
So anybody who's listening and you're thinking, my goodness me, what do I do? What do I do? I recognize I'm cranky. And, you know, I used to actually say to people, I'm a bear with a sore head. Don't push me, don't trigger me. And that's what I used to say, because I knew that I could feel that I didn't have the regulation that I normally had. And when you're in a professional career, you know, you sort of have to explain yourself to people so that they don't just, if you like, have a lens of you like that permanently. So What advice do you give to perimenopausal women?
I would monitor symptoms for a little while, which I did. You can get a scale chart printed off
Where
from
do I get one of those?
the Balance app or Dr. Newson's website, or any kind. If you look up the Climacteric scale for menopause symptoms, you can print one off and you can tick it off if you're old school. If you want to go the app, which is what I did, and then I was able to see patterns as well. So you can go into your GP and say, look, I have all of these, rather than them they've only 10 minutes. So by doing that yourself, you are empowering yourself because you know your body a bit better. And I think learning your own body is probably the best thing you could ever do.
We'll put the information that Leigh's just talked about in the show notes, and all of the doctors, you'll both let me know some details for people to read, yeah?
And also know that, most women over 40 are perimenopausal to some degree.
Right.
Some won't be, but I'm just saying most women will be. And the average age is 43, 44. It's not 53. Whereas menopause is the actual day that you're menopausal is on average 51, 52. But perimenopause starts, can start 10, 15 years before that, and you're not going crazy. So that's what I would say. Get the information that you have about your body and what's happening with it. Know that you're not, if you think you're not depressed, you probably are not depressed, and just stand your ground and say, this is what's happening to my body. It's not normal for me, and I'd like to have some checks, bloods, whatever. And the thing with the bloods is they can be normal. My bloods were normal even though I was hemorrhaging for 8 weeks. So
okay.
And can I just add to that as well? I personally have like an app on my phone that tracks my period because I'm peri, and it also enables me to check the flow, because you may find your periods getting closer, wide apart. Are they heavier? So what Leigh was saying there about tracking your body, tracking your actual periods as part of that, and also the mood swings, that enables you to communicate effectively with your partner and even your family as well, saying, look, as a side note, I'm due my period in 5 days. That's a really good time for the men to massage the feet. Look after me a little bit, please. Don't touch me that way, but look after my feet. Or whatever it is that floats your boat, because no, we get a bit cranky, but at least then they know. Don't make it about banter and say things like, oh, you're during your period then. That does not help the situation at all. It's about being supportive to make the woman feel empowered.
I do want to move on to the mental health element of this, and I mean mental health. I hope you noted that. Okay. But if I go to, not me, but if I'm one of the people watching, that I go to my GP, which app is that, Claire, that you suggested?
This particular one is a non-paying one. You can get ones out there. There's a particular one which I will find the link to and send you, that is a paid one that also enables you to send that off to your family members so they can see that you're on your period, so they know without saying anything. This one is called My Calendar.
All right.
As an app.
Yes, I had one before my chemo and I can't remember the name of it, but I think it was called Flow. I think it was, but it might be a paid one now. I'm not sure.
Called what? Sorry, Leigh.
I think it was called Flow.
All right.
But the Balance app also allows you to track things like that as well. So
all of this information will be below. So if I go into the doctor and I say, here you are, look, this is all my information. And they offer me synthetic HRT, but I wouldn't be taking that ever. That's why I never did. Now, if somebody had offered me more natural, controllable HRT, I would have said, yes, please. Yeah. So how do I make sure that I get the natural one rather than the synthetic?
I think it's just I have done my research. This is the one that I feel would suit me best. And it's the gel along with the Body Identical progesterone Nutrigestin. Or you can get a spray or a patch if you want, but they're all Body Identical, right? Okay. So the tablet form would be the old style, although there is a new tablet one out called Biojuve, which is Body Identical, but I'm not a tablet taking person particularly. I've had two the last 6 months, unfortunately, but the gel, I just rub it in and it's done. And I think it's just knowing what you want, because the GPs don't necessarily know. So you knowing what you want, and saying, I'd like to try that. And if they offer you the tablets or synthetic, you just say, no, that doesn't work for me.
Okay.
I would like that. And you have every right to. It's a joint decision.
Okay. So go to the NICE guidelines, which you can look at in Google. And as a clinician, I was ruled by those.
Yes, I'm sure you were.
I actually agree with them. So, just
I don't always agree with them either.
That is the protocol that your medical team will be using. And if they go against that protocol, then this is where the problems come. So they have to go with that protocol, even if they have a personal difference. So, your GP is a clinician who is under regulation. So, and I certainly have actually put a research forward for NICE guidelines, and they did do the research. So, that they are great. I'm not knocking them at all, even if we don't agree with them.
I mean, I personally had to write a letter to my local authority and all of this way back. So I know the NICE guidelines were there, and my doctor was not working to them. So I went straight to my local authority, and they were brilliant. So if you have a problem, because they then tell the doctor, no, you need to follow this protocol. Yes. We shouldn't have to, but sometimes you have to.
The GPs, I mean, they do their doctor training, and then they do a couple of years of, I think it's 2 years GP training. They're not experts in everything. Of course, they can't possibly be an expert in everything. They're general practitioners. So they will then refer you to a specialist. And if they're not referring you to a specialist, then that is where you need to say, I want you to refer me to a specialist, because I'm not convinced. And you can ask for a second opinion. And that might be that you can go to another doctor in the same surgery practice, or go to another practice to get a second opinion. And I think what you're both saying is that you have to be assertive, and you have to take control of your body. So those people who cannot take control of their body are people often who are traumatized, who have no confidence, who were damaged when they were younger in some way or another, and that they just don't know how to stand up to authority. Doctors are not authority. They are your servants. And they're there to serve you, and they're paid for it. They're not paid very well, but they are paid for it. So you've both talked about how trauma impacts the way we are. So if we've had a trauma history ourselves, and most people have, I mean, mental health is my background, and I don't know anybody, any of my staff or any of my patients who've not had some trauma in childhood, or through surgery, or through accident, or through grief and death. All of these things stick in your body. And you quoted the book Body Keeps the Score, didn't you, Claire? Well, for me, it's like, this happened, it's a container, and this container holds the memory of everything that happened in that event, whatever that event was. And it might have been that you saw a horrific car accident, or saw something terrifying, and your body, every single cell of it, which is the water here, recalls it. And so you're saying that this recall of that trauma can impact the way that your perimenopause is, and the way your menopause is. So if you're one of these people that you know that you've had some trauma, then tell people what to do with this trauma. Claire, do you want to go for that?
Well, I don't actually tell people really what to do when they come to see me. So if I give you an example of a recent client, she was experiencing a lot of lethargy, demotivation, sleep wasn't too great. And so she put it down to the menopause. That was her understanding from the experiences she was having. But through the process, I do something called conversational hypnotherapy, where it literally is like we're having this conversation, and through the process of me asking certain questions based on the answer she gives me, we got to a place where she naturally regressed to her childhood, and there was a lot of anger there, which she released. And it's about being heard, it's about being seen, it's about having that compassion and empathy for that person who, like Leigh was saying earlier, when you're a woman going through menopause anyway, it can feel like you're being a bit squished and you're being gaslit, and you think it's all in your head and like, oh, this isn't really happening. But if you've got underlying trauma there, which could, like I said earlier, exacerbate it, you might feel even worse. And so you're kind of putting yourself in this ball, and you're not allowing yourself to feel those emotions, because if you're dysregulated, feeling emotions can be really scary. And it's about having that safe space and that willingness for that person to just sit there and let out whatever they need to let out, but giving themselves permission to be able to do so. So that's kind of the approach that I would take. But if there was someone who doesn't want to see a hypnotherapist or a therapist of any kind to be able to work through it, there are certain things you can do, like breath work. Breath work's a really good thing to do. I often sit, when I meditate, I will listen to my body, because without going off the subject too much, women do not listen to their bodies enough, and maybe even men. And when they're not, if they're dysregulated and they find themselves getting anxious, for example, they'll just get into such a frenzy that they'll distract themselves, not deal with the issue, go out and have a spending spree in the shop, or get addicted to something, whether that's sex, pornography, whatever it might be. It doesn't have to be drugs or alcohol, and that's very cliche, but it can be other things that people become addicted to, which Gabor Mate says a lot. And so it's about tuning into your body, maybe doing the meditation and doing those breath boxes, which is a common thing. Yoga is a beautiful practice if you can't afford to see a therapist. It helps you to release a lot of pent up trauma. Exercise is also a good thing in menopause anyway. I like lifting weights in between doing yoga, and also walking. As long as you're moving your body is a massive key thing in menopause, especially when it comes to, you know, releasing all those feel good hormones, rather than, you know, that cortisol, the stress hormone that can go around your body. So in terms of seeing me, it's conversational hypnotherapy. But if they want to do their own work, I would say breath work, EFT, emotional freedom technique. The tapping is a good one as well for like on the go. So if you find yourself in a situation, this really good one with the hand, havening. There's lots of different things you can do, but all I'd say is that you can do all these things, but sometimes they can, not always, I'm not saying this is the case for everyone, they can still not deal with the problem. That's why you do ideally need to see a therapist, because you need to let it out in that safe space to be held, seen, understood, and allow yourself to just sit with what you went through. It's not your fault. It's not your fault. And that's very cliche. It's that whole Robin Williams film, isn't it?
Yeah.
And
It really isn't.
Pardon?
Really isn't their fault, you know.
Exactly.
And if
It's
they've had
really
a
not.
past, even a childhood where they weren't heard or listened to, which, you know, is most of the trauma people that we see, they weren't listened to by their parents, or they were ignored, or, you know, oh, they wouldn't do that to you, or that wouldn't happen, or whatever. When you go to the GP and they do the same thing at 46, when you're feeling vulnerable and you're not being heard, again, that goes right back to, you know, you're holding it in that cup of water, it's still there. And that takes you back to being that little girl again, who's not heard, not listened to, and feeling vulnerable, and not being, thinking she's going mad as well. And then you don't have the estrogen to deal with it either now. So you're kind of stuck in that. It's like a, I suppose, I don't even know what the word is. It's probably my chemo brain kicking in now. Can't even whirlpool. You're just like, or a hamster wheel. You don't know where to go. So yeah, it's a time of discovery, that's for sure. And if you you find the right information and you do the right things for you, it can be a very empowering time and can actually make you feel stronger. And that's what every woman should feel like. I don't like the word should, but
ideally,
do you know what I mean? Women are brought up to feel shame around their bodies, to not feel confident in their bodies, to not talk about their bodies, that it's just not as important as everything else. And that has to change as well. And we ourselves need to say, no, I want to learn about my body. I want to know the names of my body parts and what they are and what they do. You know, and we don't know, not even now, young girls don't know the difference between different body parts. It's mad, and we should, you know, so that we can talk about these things in a stronger, more empowered way, you know.
And I think that comes from your point there, Leigh. A lot of it does stem from when we start our periods. It was never discussed when I was young. Oh, it's dirty. Oh, it's smelly. Oh, pads are disgusting. And when we have that negative association, those negative connotations, no wonder we get to the menopause and think, oh my God. And all it is how I perceive it. I've got 2 young girls who are coming up to early puberty. All girls that I know of through my girls' friends are all starting very early in puberty, compared to that of me when I was like 14, 15, when I had my first period. Was you? So everybody's very different. And if we've got those negative associations, connotations, and nobody talks about it, it's a taboo subject, it's getting old, you're aging. It's not. It's the reverse of puberty, and you're free. You're not going to have those bleeds. You're not going to have these. Okay, you can still have some symptoms post-menopause. That's not a given. But, you know, it's a time to actually discover what you want out of life.
Absolutely.
People, you know, it's that
I love having no periods.
Yeah, I can't wait.
It's really interesting. That's, as you both speak, and I think we could really go down so many avenues, like sexual health and all of that. You know, so many aspects to who we are as women. And as you were speaking, I felt that need for an Indigenous life where all the women of the village lived and worked together. We raised our children together. Our grandparents looked after the children. There was a woman's circle. And I run a electronic circle, which is really powerful, and we do look at the energies within it, but to actually physically be around women and sharing our lives together and sharing our stories. And in many ways, you know, I do think that we need therapists. I'm one, of course. I know that we need therapists, but I think we need each other just to support each other and be together, you know. And I know when I used to live in nurses' homes, so that's, I don't say nursing homes, but that's what we used to call them. You know, we all ended up bleeding at the same time. You know, that's
very true.
Yeah. And it was we understood each other, and we were able to share each other and be mirrors for each other. So I do think this is all, in a sense, these damn fences that we put around our houses and the TVs that dominate our lounges all prevent us being in communion with the sisterhood.
Yeah.
And they all have that energy field, don't they?
Yeah, and I think that, you know, find people, you know, join a women's group, join a circle, providing it's functional and not a dysfunctional one.
Yeah, absolutely.
I know, you know, but if it makes your heart sing, you know, meet with other women, touch other women, and I mean appropriate touching here, you know, hugging and you know, havening, which is great, but to sit with somebody and just hold their hands is so healing, and it releases some of these hormones, doesn't it?
And I mean, through my cancer journey and losing my friend, I have a sisterhood again, and it's been wonderful. That's the wonderful thing that's come out of it, is that we hold hands, we hug each other down the street, we cry together, we were still friends before that, but it's become a 48-year-old sisterhood, you know. And it feels so wonderful because you don't feel alone, you don't feel isolated, which is something that a lot of women feel, because they're sitting in, as you say, the house with the TV and They drop their kids off at work, or go to work, come home, TV, they're not knowing that there's other women out there who are exactly the same as me, as you, and that they're not on their own. And I think that's a big thing. If you feel you're not on your own, you can do anything.
Absolutely. And do you know, one of my favorite Indigenous stories is, how we lock everybody up these days for their misdemeanors, don't we, one way or another? There's I don't know where it is, but I love this story. This man did something he shouldn't do, this young man. I don't know what it was. And most people would block him up. Anyway, I know that bit. But no, they didn't. They tied him to a post in the middle of the village. And then every single member of that village walked past him and spoke to him. And they didn't talk about his misdemeanor. They talked about his wonder and I remember you when you were 5 years old and you picked my bags up when I fell over. And they all just told him all the wonderful things he was. Doesn't it make your heart sing? And we need this. We need this in our communities. And I know that this is electronic and you can't touch us and we can't hug each other at the end of it, but there are people in your community, set yourself up, invite people around, coffee and natter. And if you think about like the quilting circles and, when all the fruit was on the trees, everybody got together and they pressed the fruit and they bottled the fruit and they did everything together. And I think as we move forward in this life, if we want to be healthy inside and out, and share this menopausal journey and this period journey with our sisters, then we have to make that difference. So thank you so much for being here and being part of this sisterhood. And my sisterhood spreads across the world, which is wonderful. But we all need the community where we live to have a sisterhood, like you were saying, Leigh. So thank you so much for being here. Final words. Is there anything that you wish that you'd been able to say before we go? They're not a hurry. I just don't like to let these videos go on too long. So
don't be afraid of it. There's a lot of scary talk about it. Don't be afraid of it.
Thank you.
I would say going on from what you said there about the womanhood and getting out there in the community, I would be careful what groups you also join in relation to it, because there are some amazing groups out there, but when you look for negative experiences, that is what you'll find. That's what you'll see a lot of, especially with the reticular activating system, which I won't get nerdy with, but on that point, I think it's choosing your women that are aligned with you, that uplift you, that empower you, that you feel inspire you. And like Leigh said, don't fear it. Look at it as an opportunity for growth, for change, for discovery, which was mentioned earlier too, in that, it is a time for when your children have either flown the nest or the puberty, and you're not the mum that you were when they were younger, and maybe dynamics have changed with your partner, your husband, or whether you're with another woman, whatever the situation might be, is that be there and use that as an opportunity to discover each other again. Now that the children have gone, use that as an opportunity for your relationship to evolve and develop and grow into something, rather than question your love. Actually discover dates again. It is, I always keep saying it, the prime word, opportunity. Always see it as an opportunity for something new to evolve and shape you, and even start a new career, go to college, everything. The world is your oyster.
I would say, ask yourself what you need. It's the perfect time to say, what do I need in my life?
Yes.
Superb. So power to women. So if you're not feeling powerful sitting listening to us here, then you know what to do. Find a therapist if you know that you've got something stuck in your body. And let that all out. and then go to a nice yoga center or a meditation opportunity and try them all in your area until you know which is the one, because you'll know it here. That's where you're going to know it. And, it's really wise, Claire, what you've said about, not just jumping in, try them all. And then treat yourself and spoil yourself and pamper yourself and find out who you truly are, what makes you feel good. And if it's going to the hairdressers or having your nails done and that's what it is, then that's great. Or if it's getting in that garden and getting your nails dirty because you're digging with your hands, do it. Whatever it is, just do what is right for you. Guys, this has been amazing. I think we need to come back and talk about other aspects of this because there are so many opportunities here. And I think one of the things about the aging body, is around your sexuality and the way you're expressing yourself. And I think that would be a really interesting conversation for people. Not one everybody would want to hear, but for those who want to hear it, be useful. Thank you so much, ladies. I really appreciate you. Bless you.
Thank you.
Thank you very much.
And if you just stay, and there'll be a small meditation at the end of this latest channel. Thank you. Thank you for joining us on that journey of empowerment. Let's just take a moment to sit or lay and breathe, noticing your breath, the way it rises and falls in your chest. Taking some full breaths deep into your lower belly and holding and releasing slowly. A very simple way to calm the mind and the body. And as we reflect on those discussions around womanhood, sisterhood, our bodies, our hormones, and how we might assert ourselves, let us do a quick reflection on our lives. As we think about what inspired us, what changes we might think we need to make, and if there was anything you didn't agree with or that triggered you, focus on that for a moment. And in these moments of silence, where we give ourselves time to listen to our highest wisdom, we can decide what we need to attend to. Make a decision now to find a lengthy period of time where you can do this work. Make a decision as to whether you need professional support to guide you to a place of healing. Or maybe that you need to set aside time to do some research about the things you've heard. There might be a friend within your own circle who needs this information, and you could sit and watch this together and talk about it. Or maybe bring the whole video to a group of women. Or share it with your partners. Just taking these quiet moments throughout your day just to ask yourself questions. Is the way we grow, is the way we transform. So just take another full breath into your lower belly, release slowly, and then come back to the present moment. And thank you so much for being here with us. If you've enjoyed this, please consider liking and subscribing. And we hope to bring you more interesting videos as we move forward. Thank you.